The CDC warns it expects the coronavirus to trigger a global pandemic. It urges the American public to prepare for when, not if, a larger outbreak sweeps the country. Touro Family Medicine Physician Dr. Meredith Maxwell joins us with a little more on this. Good morning.
Good morning.
So I wanted to do this morning because, you know, we've had Mardi Gras. People were kind of aware that the markets have been tanking and that it was spreading to other countries. But now that we've gotten out of the big party, let's focus on this. It is spreading. What should people know about how it spreads?
So it's mostly a respiratory illness that is spread through coughing, sneezing, your secretions basically. And the steps that we've taken to kind of contain it are not working out. So it's not a matter of if, it's a matter of when it comes to the United States.
Now, if somebody comes in with a case at your hospital, at your clinic, what do you do for precautions?
We have screening measures in place to screen those travelers and high-risk individuals, and then we mask up with special masks, of course, if we suspect that those people are infected. And then, unfortunately, we don't have the means in our clinics yet to test for this. So it's a CDC call that happens after that.
And there aren't 320 million masks that would be effective.
Correct.
There might be a mask that keeps you from coughing on someone, but there's not a mask that's mass-produced out there for the public that we're going to be able to get that will prevent you from being infected.
Right, and not all masks are created equal, so that's important to understand, and understanding when you're high risk is important as well.
All right, so this is respiratory. So you're not going to get this by shaking somebody's hand or touching a gas pump that somebody with coronavirus just used, generally, right?
Generally. So, but you're going to catch this from the person who's sneezing and coughing next to you, or in the back of line, or at close contact with individuals that have this.
That's not to suggest that you shouldn't wash your hands frequently, especially before you touch your face or eat food, that sort of thing.
It does not preclude you from catching other things on top of that.
So, what's the best protection as you go about this? We're in contact. Bruce could have coronavirus. I mean, I got to work with Bruce. Hope not. But I'm being facetious. But or I could have it in the future, and Bruce doesn't. How do you protect yourself?
Well, that's what they're talking about with all these possible closures. The companies are taking measures now. So you're going to see halting of schools. You're going to see shutting down of businesses to prevent the spread.
Also, before we freak people out here, most people who get this don't die, and in fact don't even get all that sick, correct?
Correct. But there are those individuals that are higher at risk that do. So we don't really know exactly the aftermath of this quite yet, because it hasn't come to our country yet.
So I guess the best advice is just be aware of what we're told by health experts and by the government as it develops.
Right, and right now we have such a small number of cases in this country that we really don't know exactly how bad it's going to be. We're expecting it to be widespread.
All right, I suspect we will review this topic again in the future.
Yes.
Hopefully not too much.
Be careful out there.
Dr. Meredith Maxwell, thanks as always. 7:17 now. Just kidding, Bruce.
I know you are. And I do wash my hands frequently, too.